The lives of thousands of patients are at risk. The Ministry of Health has issued an urgent warning. The lives of more than 4,000 cancer patients and thousands of dialysis patients are under direct threat due to critical medication shortages. Severe shortages of essential and life-saving medicines, cancer treatments, and emergency medical supplies are rapidly worsening. All available solutions will be insufficient to halt this crisis if the current conditions continue. This is a severe health catastrophe. The reality inside medical facilities is devastating. More than 1/3 of the medicines included on the essential medicines list have reached zero stock levels. Specifically, approximately 180 out of 520 essential medicines supplied by the ministry are completely depleted. For patients fighting for their lives, 50 out of the 97 cancer treatment drugs provided by the ministry have reached zero stock. Across the ministry's central warehouses, more than 726 pharmaceutical items and medical consumables have reached zero stock levels. There are severe shortages of critical specialized medical consumables, most notably dialysis filters, which are indispensable for treatment sessions. Furthermore, shortages of specialized surgical sutures, catheters, and stents have severely affected the operational readiness of surgical theaters. In laboratories, 79 items have reached zero stock in the West Bank alone, alongside 265 specialized medical consumables. The human toll is mounting. Over 11,000 scheduled surgical operations have been postponed, while approximately 65,000 surgeries were performed in 2025. Only 19,500 were carried out between January and June 2026. Tens of thousands of patients with chronic illnesses have been deprived of access to primary health care and specialized clinics. This crisis coincides with the ongoing humanitarian and health catastrophe in the Gaza Strip. Hospitals there are facing widespread destruction, the continued exhaustion of medical personnel, and acute shortages of fuel, medicines, and life-saving supplies. Healthcare needs in Gaza are increasing at an unprecedented rate. This situation stems from the complete withholding of Palestinian tax revenues, or clearance revenues, for the past 15 months. These revenues account for approximately 68% of the Ministry of Finance's income. The prolonged financial crisis has disrupted medical supply chains and weakened the government's ability to pay pharmaceutical suppliers. The ministry's outstanding debt has reached 3.8 billion shekels, including 1.3 billion owed directly to suppliers of medicines and medical consumables. The Palestinian government is making intensive, round-the-clock efforts to prevent the collapse of health services. However, there is an urgent appeal for international intervention. The Ministry of Health calls on donors to urgently provide $50 million to cover 1 year's needs for life-saving medicines. An additional $50 million is requested for other critically important medicines. Furthermore, immediate financial support is needed to cover staff salaries, amounting to approximately 60 million shekels per month. The ministry also calls for Israel, the occupying power, to fulfill its responsibilities under international law toward a population living under occupation. Action is needed now to prevent the collapse of essential healthcare services and severe humanitarian consequences.